हेलो एंड वेलकम टू द वाइट कोट नेटवर्क। आज हम हैं मैटिस मल्टी सुपर स्पेशलिटी हॉस्पिटल मोटेरा में ऑन द ओकेजन ऑफ डॉक्टर्स डे। और आज हम बात करेंगे कुछ डॉक्टर्स के साथ में, पूछेंगे कुछ कैंडिड क्वेश्चन, कुछ आपके सवाल और जानेंगे उनकी लाइफ के बारे में, थोड़ा स्नीक पीक करेंगे बियॉन्ड द वाइट कोट। हेलो डॉक्टर, हैप्पी डॉक्टर्स डे।
Thank you.
Welcome to the White Coat Network. So we'll start with the doctor's myth box, and we'd like to answer it as quick as possible.
Sure.
So, is urine leakage after 40 just normal or part of aging?
No, it's not normal. It's a myth.
Can pregnancy permanently weakens the bladder?
Sometimes it does, but there's always a solution for it.
Can menopause affect bladder health?
Yes.
Is it normal to wake up several times at the night to pass urine?
Myth, not at all.
So you should go to doctor?
Yes.
Can tight clothing increase the risk of urinary infection?
Tight clothing as well as synthetic and nylon clothing also increases the risk of UTI.
Can poor toilet hygiene leads to repeated UTIs?
Definitely, yes.
If there is no family history, can I still develop bladder or kidney stones?
Yes.
Is drinking 4 to 5 liters of water every day good for everyone?
Yes. Unless you have some kidney issues like chronic kidney disease.
Can energy drinks affect kidney health?
Yes.
Do protein supplements damage healthy kidneys?
Yes.
So recommended or not recommended?
It can be used, but with a lot of good hydration and after a doctor's supervision.
Can delaying treatment for urinary problem make them worse?
Yes, obviously.
So that was, you bunked so many myths. Now it's time for a 1-minute masterclass from you.
Okay.
So we would like you to explain it in just 1 minute or, as soon as possible. So UTI versus just drinking less water. How do you know?
So if you have an UTI, that is a urinary tract infection, you will also have symptoms like burning micturition or burning while going to urine, pain after you pee, and it is also associated with increased frequency of urination. Like every 10 minutes, you have the urge to void. That does not happen with drinking less water. So in less water, you go into dehydration, your color of urine changes, it goes into dark yellow or maybe orange. Dehydration or drinking less water, you can automatically compensate for it at home. But with UTI, you need to go to a doctor.
That's really some insightful information. And now we are on the rapid fire.
Okay.
One word your friend used to describe.
Compassionate.
One hobby outside medicine.
Gardening.
One destination on your travel bucket list.
Japan.
If you weren't a doctor, what would you be?
Maybe a cook or a chef.
One app you use the most.
WhatsApp.
And besides that, second number?
Instagram.
You are like us only. Okay, one thing that instantly relaxes you after a long day.
Sitting in my garden with a cup of coffee.
Water or soft drinks.
Definitely water.
Prevention or treatment.
Prevention.
Kidney stones or UTI, which do you see more often?
I, being a female urologist, I come across more of UTIs. Although kidney stones are also common, but UTIs are far more common.
And you are the right person to ask this. One habit woman should adopt today.
I would say 2. First is drink good amount of water, and second, if you have any urinary symptoms, please visit a urologist.
One symptoms women should never ignore.
Blood in urine, that is hematuria, that you shouldn't ignore.
One health myth you hear almost every day.
That if अगर operation से पथरी निकाली है तो फिर से बनेगी.
One food you wish people would eat less.
Packaged food and drinks.
One test women should not delay when advised.
Urine examination and a sonography.
One word that describes bladder health.
There should be a balance. It shouldn't be an overactive bladder or an underactive bladder. So a balance with a good continence describes a good bladder health.
So thank you so much, doctor. It was really insightful session with you. Congratulations and a happy Doctor's Day to you.
Thank you so much.
And आज आपके साथ कुछ candid questions पूछेंगे. Or we'll make it very quick and rapid fire for you.
Sure.
Okay. We're starting with the doctor's myth box. जानना चाहेंगे, can air pollution damage lungs as much as smoking?
Definitely, if there is a prolonged exposure of air pollution, that depends on the quality of air. But definitely, that smoke is very intense and it is directly harming the lungs.
Okay. And the people जो inhalers use करते हैं, क्या वो addictive हो जाते हैं?
Never. If it's prescribed by a proper doctor and in proper dose, it won't harm the patient.
Okay. And बहुत सारे लोग हमने कोविड से मास्क पहनना शुरू किया, तो can wearing mask reduces oxygen levels?
Never. In normal individuals, never it affects the oxygen level.
Can AC rooms makes our lungs weak?
Actually not, if properly clean, but sometimes poorly cleaned AC और अगर समझिए कि dry air है तो वो किसी को irritate करती है.
Can asthma disappear with age?
It depends on the onset of asthma. अगर childhood में है तो later on definitely symptoms may disappear, but the tendency may persist.
Can poor sleep affect lungs health?
100% poor sleep and sleep disorders से होती है, immunity down होती है, आपके cognitive functions डिलेज होते हैं और वो डेफिनेटली आपकी ओवरऑल हेल्थ पे इफेक्ट करती है.
हमने देखा है बहुत बार घर में लोगों को कभी कोल्ड कफ होता है तो स्टीम दी जाती है, तो क्या स्टीम इनहेलेशन हर चेस्ट इन्फेक्शन का इलाज है?
नहीं, स्टीम से आपको थोड़ा बहुत सिम्टोमेटिक रिलीफ मिलता है, बट इट इज नॉट अ डेफिनेटिव क्योर फॉर एनी रेस्पिरेटरी डिजीज.
थैंक यू फॉर डिबंगिंग दिस मिथ. और अब है 1 मिनट मास्टर क्लास. चाहेंगे आपसे आपकी एक्सपर्टीज पे 5 everyday habits that keeps your lungs healthy.
फॉर लंग्स आई वुड से कीप योरसेल्फ हाइड्रेटेड. प्रॉपर पानी अपना लेते रहिए, वॉकिंग करते रहिए, रिस्क वॉकिंग, बाहर एक्सरसाइज करते हैं. आउटडोर एक्सरसाइज से पहले आप एक्यूआई चेक किया करें. एक एक्सरसाइज है जो पर्सनली ब्रीदिंग या तो डीप ब्रीदिंग एक्सरसाइज, वो आपको रूटीनली करनी चाहिए. और सबसे पहले स्मोकिंग और एनी काइंड ऑफ एडिक्शन यू शुड स्टॉप द फर्स्ट.
And now we are set to have a rapid fire round with you.
प्लीज.
तो क्या आप रेडी हैं? Okay. ICU और OPD?
ओपीडी, बिकॉज ओपीडी में आप पेशेंट की डिजीज प्रिवेंट कर सकते हैं, उसका फॉलोअप ले सकते हैं. बहुत ज्यादा इंटेंस होने से पहले आप उसको कुछ ना कुछ क्या कर सकते हैं.
टी और कॉफी?
फॉर मी कॉफी.
N95 और सर्जिकल मास्क?
Most of the time N95. In routine habits, surgical mask is okay.
ऑक्सीजन और वेंटिलेटर प्रोफेशनली?
Always oxygen first, because ventilator in extreme conditions only whenever there is any requirement.
रनिंग और योगा?
I would say yoga for routine. Running is for cardiac only. So in routine, yoga is best.
One breathing exercise everyone should know?
As I said, personally breathing exercise and sometimes deep breathing is also needed.
One air quality habit everyone ignores?
That I said, whenever you go for outdoor exercise, check AQI of the environment.
Biggest enemy of healthy lungs आपके हिसाब से?
Smoking,
Smoking or pollution, which worries you more?
definitely smoking. But as I said, intense of pollution and duration of exposure of that pollution air is also very harmful.
One cough people ignore for too long?
If the cough is more than 3 weeks, I would say definitely consult your pulmonologist.
One thing patient should stop Googling?
For any symptoms, if you say you just Google what are the symptoms and correlate, but you don't get proper answer for the disease and its treatment from the Google.
तो गूगल एक तरीका है जानने का, बट नॉट द डॉक्टर.
गूगल आप जो प्रॉम्प्ट करेंगे उसके मुताबिक आपको आंसर देंगे. आप क्या परसीव करते हैं वो आप पूछेंगे. एक्चुअली क्या सिम्टम्स हैं वो गूगल नहीं बता पाएगा.
थैंक यू डॉक्टर. हेलो डॉक्टर एंड हैप्पी डॉक्टर्स डे.
Thank you so much.
वेलकम टू द वाइट कोट नेटवर्क.
Thank you. Thank you.
Let's start with debunking some myths first.
Sure.
Okay, so does drinking more water always prevents kidney stone?
No, but it certainly helps.
If there is no pain, my kidneys must be healthy, right or wrong?
No, unfortunately not.
Do kidney stones always require surgery?
No.
Can holding urine damages the bladder?
Yes.
Does drinking beer help flush kidney stones?
No, unfortunately, no, not beer, but there are many other. Anything which increases your urine output will help it.
What would you recommend for that? What to take in excess that can help the flush the kidneys?
So in Gujarat, you can take soda, coconut water, lots of normal water will do.
Can prostate problem only happens after 60?
No.
Does blood in urine always means cancer?
No, of course not.
Can dehydration affect sexual health?
Yes.
Do supplements damage kidneys?
Yes.
Can young people also develop prostate issues?
Yes.
Can too much protein damage healthy kidneys?
Yes.
Do energy drinks affect kidney health?
Yes, they do.
Can kidney stones come back after treatment?
Yes, they can.
And let's have 1 minute masterclass from you.
Yeah, sure.
Kidney stones prevention in 60 seconds. What to do?
So a simple technique is to have adequate water intake, and that you can judge by the color of your urine. So your urine should be ideally transparent or a little bit yellowish, but if it's more yellow or orange, then that means you have dehydration. So you should drink more water, decrease your sodium salt intake, and do some exercise. If you do these three things, then the probability of forming stones is very less.
And let's have some rapid fire questions. Are you ready?
Yes, yes.
Coffee or water?
Water,
OPD or surgery?
surgery as of now,
Early diagnosis or advanced treatment?
early diagnosis,
Robot assisted surgery or conventional?
conventional,
Reading or podcast?
reading,
One book that you would recommend?
Gita,
Fitness or meditation?
meditation,
One fruit every kidney loves?
berries,
Any particular?
blueberry, any type of berries will do.
One drink kidneys hate?
Any sweetened beverages, energy drinks,
Hydration or supplements?
hydration,
Kidney stones or UTI? Which is more common?
UTI.
One symptoms men ignore?
Frequent use or frequent need to go to the washroom.
One habit for lifelong kidney health?
Drink plenty of water.
One screening every person should know?
Prostate specific antigen, PSA. This is for prostate cancer.
And what is the age you recommend
So-
to be done?
So WHO guidelines says that every male above the age of 55 years
Okay.
should undergo PSA screening.
Thank you so much, Doctor. Hello, Doctor. And first of all, happy Doctor's Day.
Thank you. Thank you so much.
Welcome to the White Coat Network. And let's start with the breaking some myths from you first.
Sure. Let's go ahead.
Can a normal ECG guarantee that my heart is completely fine?
No, not always. In fact, in patients with chest pain, we recommend serial ECG monitoring and some tests like cardiac troponin to rule out any ongoing cardiac ischemia.
If I exercise every day, can I eat anything I want?
No. So that's not the right approach. Just because you're doing something does not entitle you to do something wrong.
My cholesterol is high, but I feel absolutely normal. Should I still worry about it?
Definitely. It is like gradual buildup of this cholesterol, which is going to harm you in the long term. So if you're feeling fine right now, that does not necessarily mean you'll feel fine later on. So we should definitely worry about it.
Let's hear from you for this. Can thin people also develop heart disease?
Yes, unfortunately, your body form is not the sole marker of heart, like how your heart health is. So we have seen thin, lean patients with heart attack. We have seen obese patients with heart attacks. So there are a number of factors which are into play. Just because you are thin does not safeguard you from heart attacks.
Should I avoid all fats if I want to protect my heart?
As much as possible. What is said is that we should take a mixture of different oils and limit the overall oil and ghee and butter intake as much as possible.
Is walking 20 minutes enough to keep my heart healthy?
No. So the American Society of Cardiology recommends 30 minutes of walking 5 times a week. So that's around 150 minutes of aerobic exercise per week.
Can women have different heart attack symptoms than men?
Yes. In general, young females are especially slightly protected from heart disease. But with the current increase of smoking in females and post-menopausal, female patients are as likely to have heart attack as male patients.
Thank you for such debunking those myths. And now let's have 1-minute masterclass from you.
Sure.
Heart attack versus acidity. How do you tell the difference?
This is a very good question. What I would like to highlight is please don't try and differentiate. I have seen so many patients lose their lives and lose time thinking it was acidity, trying to manage it at home. If you feel you have some discomfort in your chest, please don't think it is acidity. Go to your nearest health center, get an ECG done. Please let the doctor do that job for you and do not try and differentiate.
And let's have one rapid fire round with you, understanding your, taking a little sneak peek into your personal preferences.
Perfect.
Are you ready?
Sure.
Coffee or green tea?
Green tea.
Smartwatch or BP machine?
BP machine.
Morning walk or gym?
Morning walk.
OPD work or interventions in cath lab?
Both.
Stairs or lift?
Stairs.
One fruit you recommend to everyone?
Mango, because I like it.
Sure, we all do. One food
Please, that's not a medical advice. Yeah. Okay.
One food you personally avoid?
A lot of potato, yes. I don't like potato.
Biggest enemy of the heart?
Smoking.
One number everyone should know?
LDL level. So that is the bad cholesterol level. It is very important that we keep LDL into limits.
Cholesterol or sugar? Which scares you more?
Sugar. I think sugar harms you more in the long run.
Best investment for your heart?
Daily exercise.
How much time?
30 minutes per day. Any activity, dancing, swimming, it's all exercise. It's different forms of exercise. Anything that you enjoy.
One symptom never to ignore?
Chest pain.
One health trend you dislike?
IV drip therapy.
One habit that silently damages the heart?
Sedentary lifestyle.
One habit that protects it every day.
Being stress-free, being mindful of your own self, and enjoying life.
Thank you for such beautiful insights. And we are obliged to have you on the White Coat Network. Thank you for
Thank
your
you so
time.
much.
Thank you so much.